Our vision is that we will earn complete confidence in the care we provide and make a lasting difference in the quest to live fully. And that means different things in different programs. What is common, however, is that concept of care that's focused on the patient, as well as that treating each patient as a person. The sisters really had a heart to care for people in their wholeness, the whole person, body, mind, and spirit, with respect, excellence, and compassion. And we live those values today.
Opening with 10 beds in 1888, St. Joseph's Hospital, part of St. Joseph's Healthcare London, has grown and evolved to take up 2 full blocks on the edge of the city's downtown. Over the past 17 years of healthcare restructuring in London, nearly every corner of St. Joseph's Hospital has been refreshed or rebuilt.
We had a lot of duplicated services in London, where 2 different hospitals were providing the same kind of care. And what we did as part of the journey of restructuring within London, we looked at what was the best place of care for different programs so there wasn't duplication of services. So that allowed us to really look at focused care environments and research and academic environments where you could build excellence with a critical mass of care in one particular building.
1 in 5 adults live with at least one chronic disease, and the numbers are growing. So too is the burden of chronic illness on people's lives, the economy, and on the healthcare system. Chronic disease is a key focus at St. Joseph's Hospital. By working in close proximity, doctors across various disciplines have been able to collaborate and coordinate treatment for patients with multiple needs.
Most of us don't just come with one disorder. So if you come in with one disease or disorder, we're able to connect you to the other areas that may certainly have relevance in your care.
Medicine traditionally has been based on organ systems. And so if you had a cardiac problem, you went to the cardiology group and you dealt with that problem. I think what we've tried to establish at St. Joseph's is that for patients who have multiple chronic diseases, we try and provide a comprehensive wraparound of their multiple diseases and say, how's the best way we can serve this person who's coming with diabetes and who also has asthma and a pulmonary problem and also has chronic pain. And those things can all be managed with separate appointments, but on some occasions we actually can collaboratively look at the patient and work together to provide better care.
In addition to chronic disease management, St. Joseph's Hospital is forging new ground in day and short-stay surgery. With the latest in technology, teams of world-class experts are carving out a niche in surgical precision and discovery. Many of the surgeries performed at St. Joseph's Hospital are complex, requiring a highly specialized touch. Patients are referred from across the region and further afield. The goal is to provide an excellent patient experience, which means allowing surgical patients to return to their everyday lives as rapidly as possible, most often on the same day.
Well, when we talk about all these minimally invasive or arthroscopic or robotic surgeries, all of them are associated with less pain. All of them are associated with a more rapid return to function. So not only do patients stay in the hospital for a shorter period of time, but their pain is much reduced.
With nearly 400,000 outpatient visits being made every year to the specialty clinics, an additional 30,000 visits to the urgent care center, and 22,000 day or short-stay surgeries, St. Joseph's Hospital is no longer a traditional hospital. With a focus on outpatient care or short stays when needed, it is breaking new ground in shaping care delivery for today's needs, while also seeking solutions for tomorrow.
Hospital-based research is observing the problem, which is done in the clinic, in the operating theatre, formulating potential remedies, testing those remedies, perhaps back in the engineering laboratory or the biochemistry laboratory, and then testing those solutions back in patients through clinical trials. So that translational process is the very bedrock of hospital-based research. Our research is embedded at the point of care. Wherever care is given in St. Joseph's Healthcare facilities, research also goes on. And that's why we are an academic teaching hospital. Research is not something that goes on down the road. It goes on everywhere in the hospital. It's a daily activity.
Enriching all that takes place within St. Joseph's Hospital, from teaching and research to patient care and the work environment, is the Spiritual Care Team, who ensures the founding Sisters of St. Joseph's dedication to body, mind, and spirit is carried on.
The legacy of the sisters has been handed on generation through generation to the staff that live and work here today. They carry with them that charism, the gift of being present, truly present to those in our care. Patients, families, staff, community members, community partners, to be present to them in their times of questioning, wondering, and wandering, with faith groups and non-faith groups, at the bedside, in clinical team meetings, in the hallway, in the cafeteria, giving our full attention to them, without judgment, without asking questions, because we don't know their story. Until we invite them, may I help you.